That's like asking people to relax. You ever try that? Just relax there. Here's a hint. Let's say this is you. Representation of you. This is your mind up here. And you know, the deeper you go into yourself, the bigger it gets, and you become vast and expansive. Where do you think healing, let's call it healing, happens? Here? Where? See, it doesn't really matter whether your patients believe it or not. What really matters is whether you believe it or not. If you believe it or not, that's what will make the difference. Because you see, that's what I'm saying. Like, part of making progress with yourself is not denying all the different parts of you. And there's a part of you in there that's total skeptic and a cynic. And that's the bit that you kind of have to talk to. And if you say, what did you say? Yeah, well, it's in there going, yeah, right. No way. You know what I mean? But if you can explain it to that part, it'll go, yeah, okay, I'll buy that. My observation of successful Cranio Sacral therapists across the board is that they have mastered uncertainty. Yeah? Because the more life experience that you have, the more heartache you have, the more pain you've experienced, well, you sort of softens you up a bit, makes you a bit more, you know, sort of, you've got less of the, well, I'll give you an example. I had a student, a youngish student, he was in his 20s, and we have, you know, student clinics every month where everybody comes in and they talk about their patients and that kind of thing. And he was in one time and he said, I've got this woman, you know, that I'm treating and she's just really fat. And I was like, okay. Even the way he said it was like very judgmental, you know, so I'm like, okay, you know, he's young. And he said, you know, I said to her, why don't you just stop eating? You know, problem solved. And it was so funny because there were people who hadn't trained as much as him, you know, like people who were just starting, but they were older, they lived a bit longer. And they were falling around the place laughing. They thought it was hilarious that he was being so naive about how to solve people's problems or how people solve their own problems. So yeah, having lots of life experience is great, and it's helped me a lot. Now, when you think about the questions that you asked a minute ago about, I don't know whether I'm using the right technique or not, okay? If you find yourself now thinking, this is the absolutely right technique, you will be concerned, and you'll be rightly concerned. Okay? If you're thinking, this is absolutely what's wrong with this person, I'm 100% sure I know what's wrong with this person, you'll be concerned now, and you should be concerned. Because now you understand that it's not supposed to work like that. You've got to be, your mind is playing catch-up the whole time with the bigger part of you, with the deeper part of you, the bit that's actually doing the work. Your mind is trailing behind that, doing its best to make sense, to make concepts, and to make words that it can use to describe to you, and more importantly, to the person that you're treating, because they're going to ask you, as you just said,